what I wanted to start with here is that some of the interpretations that CMS has put forth in this 4201P proposed rule are not new. In fact, they're not even close to being new, because when you go back and look at some of the things that the OIG has said in the past, not only in the April 2022 report, but I think even in the prior report that they published on Medicare Advantage Denials. And when you look at Maximus, which if you don't realize, Maximus is the independent review entity that is charged with Medicare Advantage oversight. When you look at the oversight of Medicare Advantage plans, there is a 5-step CMS appeals process that is available to beneficiaries should beneficiaries choose to question a denial that's issued by the Medicare Advantage plan. Level 1 review is with the plan itself, and then if the plan upholds the denial or does anything other than issue a fully favorable determination to that appeal, they actually have to auto forward that appeal to level 2, which is the independent review entity, which is Maximus. So Maximus actually holds the federal contract for this very important place of Medicare Advantage oversight. We got a glimpse into, or not more than a glimpse, we got tremendous amount of insight into how Maximus oversees the Medicare Advantage plans last May 2022, when Maximus made public a redacted version of essentially all of their decisions with regard to Medicare Advantage. You can access this if you do a Google search for Chapter 13 of the Medicare Managed Care Manual. CMS now maintains that and related information on a web page. And on that web page, you will find a link to the Maximus searchable online database of review decisions. So Maximus, for years now, has held Medicare Advantage plans to provide coverage for what fee-for-service Medicare would cover. It's as simple as that. Cited in practically every decision, whether it's favorable or unfavorable, but the ruler that they use, the standard, the bar that they use, is this 42 CFR 422.101, which basically says that they have to provide coverage by furnishing, arranging for, or making payment for, and I want to stress making payment for, all services that are covered by Part A and Part B of Medicare. That language has been in the Medicare Advantage regulations since 2000. When you go back and read the 4201P proposed rule, you'll see that they reference a Federal Register publication from June of 2000 when they're talking about, if the service can be provided in more than one manner, then the Medicare Advantage plan, can choose in which manner that service will be furnished. This comes from the same document, and some of the other things that we'll talk about as well, that are in that same document. The requirement to cover what fee-for-service Medicare Part A and Part B cover has been there for over 20 years. It's what Maximus has been using to adjudicate Medicare Advantage denials. It's what the OIG physician reviewers, even though, as Denise mentioned, that the OIG said that CMS wasn't entirely clear whether they could use internal criteria. When you look at the appendix of that April 22 report, you will see that the physician reviewer for the OIG disagreed with Medicare Advantage decisions on utilization review, including a couple of level of care cases, and disagreed because the Medicare Advantage plan appeared to use criteria that were not present in fee-for-service Medicare. So, one of the key points is that CMS is really just getting back to what really has been in place for a long time, even back to 2000. CMS is reiterating this. I just want to stress that what CMS is proposing is not new. It may not be what you're used to, it may not be what you experience, but I want to stress that it is not new. And the idea is that you cannot deny based on criteria that are not present in fee-for-service Medicare when it comes to basic benefits. Basic benefits are those benefits that are provided under Part A and Part B, as opposed to supplemental benefits, which are extra things that Medicare Advantage plans can offer that can improve health, things like dental services and gym memberships and other things. Those would be supplemental benefits. So when you're adjudicating a basic benefit, according to the proposed rule, you must use fee-for-service Medicare criteria in order to decide that.